The patient that we considered in this particular situation was someone who had a high FLIPI score and had a relatively poor expected overall survival from diagnosis based on his advanced age and based on how advanced the disease was. For many patients with follicular lymphoma who fall into the lower FLIPI risk category or who have a very good response to their initial line of therapy, their expected overall survival is not that much different from age-matched controls. And so while follicular lymphoma is expected to be a disease that is not curable with standard therapy, many patients will have subsequent relapses and be treated and then retreated and retreated again. And so it is relatively common now to see patients who are treated in the third line or fourth line or even later lines of therapy with the management of their follicular lymphoma. When we think about the options that are available in that setting, there are now 3 PI3 kinase inhibitors that are approved in that setting. Idelalisib is one of those. Duvelisib is a second of those that is approved in that setting. And copanlisib is an IV formulation of a PI3 kinase inhibitor that is also available in that setting. When we think about relapsed and refractory follicular lymphoma, the ways that we think about those agents are that their efficacy appears to be more similar than it is different, that the response rates overall are in the 40 to 50% range for the majority of those agents. And patients have meaningful progression-free survival that can be a year or more for the majority of those agents. The distinguishing features stand in terms of the ways the drugs are given. So copanlisib, as mentioned, is an agent that is given on an IV formulation. For some physicians and some patients, they may consider an IV formulation an advantage in that patients are getting therapy and you know that they're getting therapy when they come in to get their IV medication. For other patients and physicians, they may consider that a disadvantage when they could instead be having therapy that is administered as an oral agent that they take at home and don't need to come back to the physician's office to get care. The other things that we see as difference between those PI3 kinase inhibitors are the forms of PI3 kinase or the isoforms of PI3 kinase that they affect. So idelalisib is an inhibitor of the PI3 kinase delta. Copanlisib is a pan inhibitor of PI3 kinase, so it affects both the alpha and beta PI3 kinase. Those are ones that have other adverse effects associated with them, and so patients need to be monitored closely for hypertension while the drug is being infused, and need to be monitored for hyperglycemia, which can be cause additional difficulties if the patient has predisposition to diabetes or hyperglycemia for other reasons. The other form of PI3 kinase inhibitor, the duvelisib, is more similar in nature to the PI3 kinase delta inhibitor idelalisib than it is different.